Meeting is being recorded.
Okay, good afternoon, everyone. I want to make sure we have everyone, we had a Mandarin interpreter who was in the waiting room, and I believe our clerk person as well. So I want to make sure that we have all of our folks available and interpreting before we get started. We have a number of people presenting this week. People may notice in your screen today for people participating on their computer in Zoom, you'll see the interpretation icon at the bottom. We will have one presentation that will be in Spanish, and so for people who require translation, you can click on interpretation and hit English when we get to that. Otherwise, for the folks who are with us,
J-O-R, capital J-O-R.
Princess at Germany
for
or
the people,
Italy,
You could please mute yourself.
Spain, Greece, or England.
if people could remember, please, you couldn't hear me because someone hit mute all that's the challenge. On Teams, we can see who's speaking and just mute the one person. I think Charlisa probably muted us all to cut out some of the background noise. So if we are ready, Charlisa, please to share the screen with the COVID data. As I said, we have a lot of folks presenting today, so I want to make sure that we get everything in and have time for people's questions. I'll just give an overview as you get that PowerPoint up and ready to go. So we will have some visitors today from DC Health. The state epidemiologist, Dr. Anil Mangla, will be providing a presentation. And accompanying Dr. Mangla, we also have some other staff from DC Health who will be available to answer any questions. That's Aisha Nixon, Assad Bangili, and Kimberly Summers. I want to thank Dr. Bennett, our new DC Health Director, or the acting director still maybe of DC Health. She was, when I asked, she was really interested in making sure that people have all the information they need to prepare for our upcoming flu, RSV, COVID season. We also today will have a presentation from Yanida Menjivar. Ms. Menjivar is a disability advocate in the Latina community in DC. And she will be our keynote speaker at our Latinx conference next Saturday, September 30th at the DC Education, the Columbia Heights Education Center at 10 a.m. next Saturday. And then lastly, Winslow Woodland, the DDA Deputy Director, will go over again the specific data from our COVID study. So now, just briefly, the COVID data for DDA. To date, we have had 831 people supported by DDA who have contracted COVID. There were 12 people in September so far who have contracted COVID. By placement type, in September, 9 of those 12 were in supported living placements and 3 were in natural homes. Overall, during the pandemic, we've had 1 in a correctional facility with COVID, 26 in host homes, 154 in intermediate care facilities, 1 in a mental health facility, 189 in natural homes, 2 in a nursing home, 7 in out-of-state placements, 62 in residential habilitation placements, and 389 in supported living placements. One concern this month is, once again, we are seeing people who have required hospitalization for treatment of COVID. I'm thinking this will scroll down there in just a second. So there were 2 people this month who have required hospitalization. During the course of the pandemic, we've had 146 hospitalizations. Not unique people. One of the people this month had a previous hospitalization. Fortunately, both people are back out of the hospital now and receiving treatment at home. And we have had 38 people who have lost their lives to COVID. The most recent being in September of 2021. So it's been quite some time. That is good news. The concern, of course, we are seeing COVID bump up again. And as I said, 2 hospitalizations. So it's a nice segue. And we were very happy to hear that DC Health could provide staff to participate in today's meeting. So Dr. Mangla can take over from here and provide some information for people regarding preparation for our upcoming flu, RSV, COVID season.
Good afternoon, everybody, and thank you, Director Reese, for having DC Health as well as myself to present. I'm glad to kind of share some of the information in the district, and also I have talked to this group before, so I'm glad to kind of, be part of presenting and answering any questions today. So before we start, let me share my screen, and then we can get started. Let's see. Okay, can everybody see my screen?
No, we cannot.
Nope, let's try it again.
There we go.
How about now? Yeah.
Yep.
Okay, perfect. Okay, so I have a few kind of slides. So as we get into the respiratory disease season, we want to be very kind of proactive and provide the information to the staff in the district on, what the season is about, the prevention measures, and just kind of giving you some idea of resources that are available within the district. So real overview, we just want to go through, and the overview is, when we're looking at viruses that cause these respiratory diseases. So number 1 is COVID-19 that we have kind of dealt with for the past 3 years, but we've also seen influenza, and we've now seen RSV that is starting to circulate now. During COVID, we didn't hear much about RSV. Doesn't mean it didn't exist, right? This is something that has been there, but again, we've seen more and more of this. Individuals who are immunocompromised and who have had other really chronic medical conditions are always higher at risk and for this, and also with complications regarding these viruses. This is the first year that we have a vaccine available for COVID-19, influenza, but we have now RSV that is actually a new vaccine for this kind of season and moving forward. So that's really good news. Knowing what we saw with RSV last year, especially the hospitalizations. Upcoming respiratory disease season, as we're looking at, is going to be expected to be very similar number of hospitalizations like last year. So again, this is really trying to get prepared and seeing how we can prevent, anybody getting RSV or COVID or even flu as we move forward towards this season. When we're looking at our surveillance, right, which is again really important, this is from the CDC side. So as you can see, CDC, what happens is data is received at CDC, and they look at this, what's called ILI activity. Now, ILI is actually influenza-like illnesses that actually has flu in it and other symptoms like flu-like symptoms. So at the moment, they have categorized this into very high and then also minimum. And as you can see right now, we are at this moderate level, and that's kind of indicated right there. When you're looking at COVID-19, so just a little history and information on COVID history. What is COVID-19? COVID-19 is a coronavirus. It is a disease that is caused by the virus called SARS-CoV-2. So we've heard of SARS, right, about a decade ago. And so again, these are all these families of the SARS virus. It is very contagious and spreads very quickly, as we know what had happened during Omicron and Delta. And so this is not unusual, but what we do see is these mutations keep occurring. Thus far, 1,436 people have died of COVID here in DC. COVID-19 often causes a lot of the respiratory symptoms that we feel, which is very similar to like the cold and flu or pneumonia if you go to that next level. So COVID-19 may attack more than just your lungs because it's respiratory and the respiratory symptoms. Other parts of the bodies may also be affected, and that's why when we look at immunocompromised individuals, they are at high risk. The reason is if someone is on, say, transplant medication or had a transplant, someone's on dialysis, right? These are kind of individuals that are immunocompromised and at risk because COVID affects these other organs as well. Most people with COVID-19 have mild symptoms, but some may become severely ill. Again, the message of the vaccination is so crucial. So even if you get vaccinated and get COVID, you may not get hospitalized, or your symptoms may not be that severe. Some people, including those with minor or no symptoms, will develop post-COVID conditions. And then this is something that you normally hear in the news and media, which is called the long COVID. This is our local data. So COVID hospitalizations by week in DC. If you kind of look at, our numbers are slowly starting to go up. But when you look at the matrix, we actually right now with the admission level, we are on medium. But when you're looking at the COVID-19 emergency visits, we are on low. Again, that low, right, we are on, but as you know, the season is just barely starting. Again, that prevention method and the prevention is really going to be crucial. So talking of prevention, what are these next steps of prevention? The prevention includes improved ventilation, right? This is something that CDC is really focusing on. The more ventilation you have, as this is a respiratory disease, you want to have more openness, and that's going to be very helpful. This is something that has been data-driven and is best practices, especially when you're looking at schools and congregate settings and so forth. Getting tested, again, very important. You get tested for COVID. If you are positive, you want to stay at home so you don't infect anybody else. Following recommendations for what to do if you have been exposed, and our recommendations are on our webpage, and that be important because we really kind of, strategize each of these steps on what the recommendations are and how to follow. Staying at home, again, if you have suspected or confirmed COVID-19 is important, because staying at home, you're going to not infect anybody at work or anybody else, that you are close to. Seeking treatment is very important if you have COVID-19, especially if you are high-risk setting and very sick. You do also want to kind of seek treatment, go to your healthcare provider, who will then guide you what is the right treatment as well. Avoiding contact with avoiding contact with people who have suspected COVID is again going to be crucial, because as we know, respiratory diseases, and they spread by these droplets that are in the air. So again, that's kind of good prevention. And of course, hygiene, right? Cleaning hands, making sure you're using a sanitizer are again the basic key factors when we're looking at prevention of COVID. Then we're looking at latest vaccine recommendations. So there is a new updated COVID-19 vaccine that is, ready, and people actually, one of my pharmacies is already taking appointments. And so if you have that possibility, it would be important to get this vaccine. It's also called the monovalent vaccine. So again, important to know that. Everyone age 5 and older should get 1 dose of this updated vaccine. People with moderate or severely immunocompromised may get additional doses of the new vaccine after consultation with their healthcare provider. Parents of infants as well as children ages 6 months to 4 years old should consult again the healthcare provider regarding the dosing, because the dosing may be different, and that is going to be an important factor. Treatments, we know that treatments are available for COVID-19. It is best to, again, meet with and consult your healthcare provider to give you appropriate directions and treatment recommendations. COVID-19 opportunities. Again, COVID-19, COVID-19 vaccines can be obtained at your primary care provider, your pharmacy, and then also the home vaccination program. Community groups can host events and request vaccine administration through our vaccine exchange. And there is a website. There's also a phone number that individuals can call and then get more information on that. So let's talk a little about, let's go with influenza. As we know, flu is divided into, you look at flu A and flu B, right? So the basics of flu is again contagious respiratory illness caused by the influenza virus that can affect the nose, throat, and sometimes the lungs. It can cause mild to severe illnesses, but at times can lead to death. So, we actually look at this, we monitor this. Deaths for the, under 18 is reportable to CDC. So we really kind of monitor this very closely. So we know flu-related deaths in a district. And this is kind of a statewide protocol that CDC have implemented. So how does flu spread, right? We've talked about kind of COVID. So most experts believe that the flu virus spreads mainly with these tiny droplets that we talked about, made when people have flu cough, sneezing, talking, right? These droplets can land on the mouths and noses of people who are nearby. Less frequent, a person might get flu by touching surfaces or objects that has flu virus on it, and then touching their mouth, nose, especially the eyes. So when you're looking at flu, it may be suspended in the air, but more, when you're touching your mucous membranes, that's kind of where, you can get infected pretty quickly. So flu prevention, again, most important, the first most important step is that get your flu vaccine every year. Why you want to get it every year? Again, it's just a simple thing of flu strains change throughout the year. So when we look at flu vaccines, they normally look at the East, right? What has happened in the East over the past 9 months. And then that kind of strain, we kind of look at that strain, flu vaccines are then developed, and then those strains we have. So the current strain is the most, important, because that flu strain is the one for this particular season. So someone may ask, hey, I got my flu shot last year. That's great, you got it, but it may have that different strain that's circulating this year. So it's important to get that flu vaccine. Much like COVID-19, the CDC recommends everyday prevention actions like staying away from people that are sick, covering their coughs and sneezes, and then again, frequent hand washing. So again, very similar. They all fall in that same category, right, of respiratory. So these prevention methods are also going to be very similar. To help slow the spread of the germs, again, that hand washing, using a sanitizer is kind of the key prevention methods as well. So treatment, again, when the treatment is started within 1 or 2 days after flu symptoms begin, influenza antiviral drugs can then again lessen symptoms and shorten the time of a patient that may be sick by at least 1 or 2 days. They might also prevent some flu complications like pneumonia, right? So if you leave flu, and again, many that may be immunocompromised, have chronic health issues, this flu may change into that pneumonia. For people that are higher risk, also adults, right, of serious flu conditions, treatment with flu and the flu drugs can mean the difference between milder and that serious illness, possibly resulting in hospital stay. So again, really important to get that treatment in time to avoid also that hospital stay and serious illnesses. So flu vaccine opportunities, again, the same when we're looking at these, it's flu vaccines can be obtained at primary care providers, your pharmacies, and then home vaccination or the home vaccination program, and then community groups that are hosting these, and also request vaccine administrations through the vaccine exchange. So let's look at the third one that we have talked about is RSV. What are the basics of RSV? It's RSV stands for the respiratory syncytial virus, or RSV. Is a common respiratory virus, right, that usually causes mild flu-like symptoms. We heard of it last year. Many, prior to that have not heard of it. But again, this is kind of starting to see that we've seen more of this coming around. Most people recover within a week or two, but RSV can be very serious. Infants and older adults are more likely to develop the severe symptoms of RSV and would maybe require hospitalizations. Regarding RSV, there is not a specific treatment for this. What are the symptoms? So according to the CDC, people infected with RSV usually show symptoms within the 4 to 6 days after getting infected. These symptoms of RSV infection usually include your runny nose, decrease in appetite, coughing, sneezing, fever, wheezing. These symptoms usually appear in stages and not all at once. Very young infants with RSV, the only symptoms that they may have is irritability, decreased activity, and breathing difficulties. Older adults may not even have any symptoms. Almost all children will have had RSV infection by their second birthday. So that kind of tells you that how common RSV is. But again, this could get very serious in certain circumstances and certain high-risk populations. So prevention, right? Respiratory, again, prevention is very similar to the COVID-19 and flu. Cover coughs and sneezes with the tissue or your shirt sleeve, not your hands. Wash hands often with soap and water for at least 20 seconds. Use sanitizer if you have that available. Avoid close contact with others, such as kissing, shaking hands, and sharing cups and eating utensils. clean frequently when you're looking at touch surfaces, such as doorknobs and mobile devices. So let's talk a little bit about the RSV vaccine information. So for adults 60 years old and over, adults 60 years of age and older may receive a single dose of RSV vaccine using shared clinical decision-making. Again, get this information by your healthcare provider. With infant and young children, there is 2 monoclonal antibody products available through consultation of your healthcare provider. And then these monoclonal antibodies are immunizations that provide an extra layer of defense to help fight RSV infections and protect children from getting sick. When we're looking at numbers, what is that burden, right? So the annual RSV burden amongst adults ages 65 years and older, as you can see, almost 900,000 to 1.4 million medical encounters have occurred, 60,000 to 160,000 hospitalizations, and 6,000 to 10,000 deaths. So again, high-risk population, it's important to know what's the prevention methods and what is available there to help, avoid and prevent RSV. So in closing, that was a lot of information, but in closing, we have a website that you can reach with the website kind of given, the link given in the slide. We do have all that information on COVID-19, on flu, and on RSV. Again, when you're looking at these 3 respiratory diseases, the main things here are wash your hands, mask if you're in covered areas, in these crowded areas, stay home when you're sick, cover your cough, and then of course get your vaccines that are available. And this is again, make sure that you reach out to your healthcare provider who can then guide you what are your next best steps. So there's a lot of great information on these one-pager. And again, this is available on our website. So on that note, I'm going to stop and ask if anybody has questions. I do want to thank many of our DC Health staff. We have subject matter experts that would kind of also provide any information that you guys need. So let's open this up for any questions and see how we can assist in that way. So thank you, guys.
Thank you very much. I also just want to, there was a couple of questions while you were talking, which were responded to, but I want to make sure that people who may not have been watching or don't have access to the chat would know what those questions were and the answer. So when should you get the vaccine if you've recently had COVID, as well as how long should you wait for the new COVID vaccine if you got the bivalent? And Ms. Summers answered both of these. If you've had COVID recently, you can consider waiting 3 months before getting your updated vaccine. And if you got the bivalent vaccine, wait at least 2 months before getting the updated vaccine. Can we get a copy of the flyer that you just showed? I think the whole PowerPoint will be available on our website next week, so people can download that flyer from there. Okay, so there's also a note here from Robin Diggs Purdue, who's the interim senior deputy director at DC Health. Just letting people know, I'm sorry, Dr. Summers, I said Ms. Summers, but that we also have Dr. Kimberly Summers, Dr. Assad Bundili, and Aisha Nixon, who are available to answer questions that people may have. Are there any other questions while we have our DC Health folks here with us?
Thank you,
Okay.
everyone, and I also added a link to the flyer to the chat.
Oh, great. So people can see there's a link in the chat for both the PowerPoint and the flyer. So Dr. Mangla, DC Health staff, thank you all very much for coming today. Thanks for that really comprehensive presentation. People have like one last chance if you have any questions. Otherwise, we will move on now. Okay, thank you.
Thank you.
Thank you. Thank you
Thanks
very
so
much.
much.
Thank you.
So next up, we have a presentation from Yanira Menjivar. Ms. Menjivar is a disability advocate in the DC Latino community. She will be interviewed today by Miriam Bolaños from DDS. This interview will be taking place in Spanish. So the sound that you will hear in the main room will be Spanish. For people who do not understand Spanish, you can click on the tab at the bottom of your screen that says interpretation. And there's a tab there that says English. And for the English, when you click on the English tab, you will get the interpretation of the interview between Ms. Bolaños and Ms. Menjivar. So with that, Miriam, it's all yours.
Creo que sí. ¿Nos oyen todos? Hola, buenas
I can
tardes.
hear both of them.
Sí, okay, they hear us. Go ahead.
Can
Adelante.
we try that again?
Muy buenas
Ah.
tardes a todas y a todos.
Okay.
Mi nombre es Miriam Bolaños. Yo soy consejera vocacional en el Departamento de Discapacidades en DC. Y el día de hoy invitamos a la señora Yanira Menjivar, que nos va a contar su experiencia aquí viviendo en esta linda ciudad. Lo que queríamos antes mencionar es que es muy importante el mes de septiembre para todas las personas que hablamos español, porque los hispanos que vivimos en Estados Unidos ahora, con el último censo del 2020, resultamos ser 62 millones de personas. Entonces, sí, sigue creciendo la población. Y es el mes nacional de la herencia hispana, precisamente para darse la oportunidad de conocer y celebrar nuestras comunidades, nuestros antepasados y a todas las naciones de Latinoamérica que reúnen a la gente que habla español, incluyendo España. Entonces, estamos hoy platicando con la señora Yanira Menjivar. Primero que todo, gracias por estar aquí con nosotros. Quisiéramos saber un poquito más de usted, que nos cuente cómo ha sido estar acá.
Buenas tardes a todos y a todas. Mi nombre es Yanira Menjivar y ya que es una felicidad estar aquí en este país porque y es bueno celebrar la independencia de nuestro país. Es como aquí en Estados Unidos. Y nosotros somos latinos y da la casualidad de que gracias a Dios estamos aquí por una lucha que nos trajo él para acá, para poder salir adelante. Y la independencia es mucho agradecimiento por las ayudas que dan y nos brindan. Aparte de eso, nos ayudan a reflexionar muchas veces de que nosotros decimos no podemos, pero sí se puede. Al querer es poder, como dice la palabra de Dios. Entonces el querer es poder, y así que es bueno aprender muchas cosas y aprender un poco, en que sea poco, pero entender en inglés. Eso sí es bastante independiente aprender en inglés, porque cuando yo vine aquí a este país en el 2005, trabajé 5 años. Trabajé en el día de preparación, era preparadora en restaurante. En la noche trabajé en limpieza, un part-time, y trabajé por mis hijos que quedaron allá en El Salvador y mi madre. Cuando estaban chiquitos, y gracias a Dios ya lo estamos aquí. Pero a pesar de la situación que me sucedió, del accidente que tuve en el 2019, en el 2009, tuve un accidente. Un muchacho llegó a dispararnos a la casa y mi pareja murió. Entonces, los doctores me dijeron que iba a quedar como un vegetal. Y para Dios no hay nada imposible. Y gracias a Dios estoy aquí contándole para que los que estamos deshabilitados busquemos la ayuda, porque a veces se nos mete en la cabeza que no podemos, pero sí podemos. Si la buscamos, la vamos a encontrar, pero si no la buscamos, no la vamos a encontrar. Entonces, y gracias a Dios, Dios me regaló un hermoso regalo, que es una niña, que es una hembra, que hoy tiene 4 años, va a pre-kinder y ya el otro año va a ir al kinder. Y gracias a ella me está sacando para adelante para darle un futuro bueno y aproveche las carreras que va a agarrar. Y después de eso.
Sí, la pregunta que le queríamos hacer, ¿cómo fue el proceso de pensar en regresar a trabajar y encontrar los servicios de RSA?
Yo me di cuenta porque una amiga me dio un tratado de que iban a ayudar a buscar trabajo ahí en la alcaldía. Entonces me fui a meter ahí en la alcaldía. Ahí me doy cuenta de que vi un rótulo que decía: ayudamos a gente discapacitada para trabajo. Entonces le fui a preguntar a la muchacha y dijo: sí, yo la voy a recomendar a esta persona, y que es Miriam Bolaños. Me la presentó, y gracias a ella y a Dios que ella me está ayudando a ver cómo consigo trabajo, porque yo soy, gracias a Dios, porque Dios me regaló la ciudadanía también. Este año, en mayo, me voy haciendo ciudadana, y por eso yo no le hallo estar en la casa solo por estar. Yo no le hallo, porque yo me crié trabajando en el mercado con mi mami, y después trabajando aquí día y noche. Entonces, eso fue un orgullo para mí. Cuando vine a este país fue gran maravilla, porque empecé a trabajar, y más ahora que las encontré a ustedes, a ella más que todo, y a Alison, que me dio la oportunidad de venir a contar mi historia, para que los que están discapacitados les puedan ayudarles, se les pueda quedar en la mente buscar ayuda, porque si no la buscan, no la van a encontrar. Y gracias a ella que estamos viendo cómo buscamos trabajo, porque a mí me gusta tener la mentalidad ocupada, no me gusta tenerla desocupada. Es mejor tenerla ocupada en trabajar. No la gran cantidad, pero me gusta. A veces yo ayudo a la gente, lo hago de corazón, no lo hago por interés. Y muchas veces tengo a Ana también Rondón, que ella me conoce. Ella me dice: tú sos una maravilla. Me dice: ¿por qué? Le voy a contar un poquito lo que ella pasó. Ella tiene cáncer. Y le dije un día, le encontré ahí por Tiger. Y ella me dice: Lupe, me dice, ¿qué fue? Ándale, mira, y vos andas peluca. ¿Ese peluca? Le dije yo. No, es de peluca, deja de me estar mintiendo, es peluca. No, me dijo, es peluca, Ana, yo la conozco, es peluca. Y se la quitó y dijo, no, no, si Dios te va a dar, te va a poner pelo de nuevo. Si vos lo crees y lo confesás que Dios te va a dar pelo de nuevo, te lo va a dar, pero si no lo crees, no te lo va a dar. Entonces ahora me dice, siempre que me mira, me saluda, me da un abrazo, me da un beso en el cachete, gracias a ti, me dijo, yo he creído en Dios, mire, y gracias a ti, me dijo, tengo pelo mío propio, y se agarra el pelo y se hace, y el pelo de ella, yo lo tiene largo, no lo tiene corto.
Gracias, Yanira, por contarnos su experiencia y nos inspira a todos muchísimo saber que quiere hacer muchas cosas en su futuro laboral. Nosotros estamos trabajando, tratando de asistirla primero con una evaluación tecnológica para saber qué tipo de tecnología puede necesitar para poder eventualmente trabajar. Eso, en ese proceso estamos. Yo no sé si las personas que nos acompañan el día de hoy tienen alguna pregunta o quisiera, o pasamos a...
Vamos a ver.
Y si tienen preguntas, que pregunten. Pues gracias a Dios nos dé palabra para poder contestar.
Sí, excelente.
Podemos
Estuvo bien.
pausar un poquito para la interpretación.
Are there any questions that people have? I don't see any questions in the chat other than how to access interpreter. There's a question in the chat I was gonna, Yanira, how is your family?
Hay una
adjusting to
pregunta.
the United States?
Gracias a Dios, al principio no la hallaban los dos varones que me traje en el 2015, me traje a los dos varones. Y la ciudadanía la tuve por, gracias a Dios, y gracias a los abogados que me ayudaron a meter papeles, porque cuando me pasó el accidente, me dieron 2 balazos y no era mi ilusión de tener papeles, era poder caminar, y yo sé que algún día Dios me va a parar de esa silla y voy a caminar algo renca, pero voy a caminar, primeramente Dios, porque así lo creo, y todo lo que dice uno, se cumple lo que Dios promete, lo cumple. Y gracias a mi familia está creciendo. Uno tiene 23, el otro tiene 20, la otra tiene 16 y la niña de 4. Ahí estamos luchando para poder sacarlos adelante, en que yo sé que yo sola puedo, porque el papá de la niña, yo no está conmigo.
Marco, gracias por compartir.
There are also
Gracias a
notes in the chat.
ustedes porque
Congratulations.
están escuchando mi testimonio.
And congratulations on getting your citizenship. It also says in the chat.
Gracias.
Yo tengo una pregunta, voy a tratar de hacerlo en español.
Bueno,
Hay nuevas reglas para los servicios de salud, para hacer los servicios más accesibles a las personas con discapacidades. Y yo quiero escucharle qué usted piensa sobre los servicios de salud de DC y qué piensa, cuáles cambios piensa que necesitar realizar para hacer los servicios de salud más mejor para las personas con discapacidades.
Que siento yo de que la salud es importante para muchas personas. A veces hasta para los americanos es necesario porque yo he visto gente discapacitada americanos y yo siento que el seguro sería bueno que se lo dieran. Si tiene papeles o no tuviera papeles. Es lo bueno que sería porque yo he visto gente discapacitada que no tiene papeles y es triste y es muy triste que no se los dan porque no tienen seguro, porque no tienen residencia y es bien triste que no lo den. Y yo quisiera que esa parte, si pudiéramos echarnos la mano con unos o con otros, hoy dice un dicho, hoy por mí, mañana por ti. De eso pienso yo que sería bueno ayudarnos a la gente discapacitada para el seguro médico.
Hacerlo universal.
Hacerlo universal, hacerlo para que todo el mundo tenga o sea que está deshabilitado o no deshabilitado, tenga papel o no tenga papeles, pero el seguro se lo deberían de dar, porque todos lo necesitamos, hasta los niños a veces lo necesitan.
Gracias.
No, nada.
Okay, thank you. Oh, thank you very much for sharing today.
Hay otra.
I look forward to
Yeah.
next Saturday, seeing your presentation. Or fifth.
Hay otra presentación, ¿no? Así.
So
Ya,
next
porque no le
on
puedo
our
preguntar.
agenda, Winslow Woodland, the Deputy Director, DDA, provide an update or another presentation. I think we did this 1 or 2 months ago, but he's got some more data to fill in to answer your question regarding the COVID study that was done by a contractor. So I'll turn it over now to Winslow, and I believe that Charlisa will be sharing the PowerPoint.
Yeah, and also I just wanted to have everyone, if you can switch back to the original audio for the next presentation.
Okay, good afternoon, everyone. I am going to go through the data related to our COVID study. As the director restated, we did a general overview of the study on the 28th of July in this forum. And I'm hearing a little bit of feedback, so. Yes, thank you very much for that. Essentially, I'm just gonna go through the first 8 slides relatively quickly. Why we did the study. We wanted to understand what people's experiences were relative to.
Charlisa?
Yeah, essentially, to determine the long-term physical and psychological effects that the COVID-19 had, and if there were any negative outcomes relative to those. Next, please. It's essentially, we identified a target group of people. We wanted to ensure that the more than 600 people who had tested positive were a part of the study, and that was from March the 20th. And we looked at the 2-year period from March the 20th, and we began collecting data in October of 2022, and we ended in 2023. Next slide. So we did, we had a total of 740 people that were a part of the survey, and 85% of those responses came from natural or the natural or paid supports, people who supported people that we support. And WellCentric broke down the survey data. WellCentric is the provider who we contracted with. It's a local CBE and small business in the District of Columbia. And next slide, please. And so we had 5 domains, and the domains were, I'm sorry, next slide, please. All right, and so the 5 domains are listed on the screen. We'll revisit them as we move along, so I'm not going to go through each of them now. Next slide, please. And this is just a general description of the slide. This is from the July 28th presentation. It's also posted online, and this presentation will also be posted online. Next slide, please. And then the last 3 domains as listed. And so we're going to just jump right in, and I'm going to be moving relatively quickly, but I'm also going to be mindful that the interpreter has to be able to hear me. So this is going to be just an overview. I thought to do it this way. So there were 30 questions. The first question is, where are you getting information related to COVID? And the answer, the vast majority of studies.
Next slide, please.
The vast majority of participants, which was 318, received their information from a healthcare provider. And then the largest, this was the largest reported amount from any single source. 303 or 41% reported receiving their information from a multitude of sources. And the list of sources is there, and I'm not going to. Sorry. Yeah, I'm sorry. I was talking really fast, and again, I said I wasn't going to do that, so I apologize. So, next slide, please. I'm sorry. The previous slide, I didn't realize you could advance the slide. So question 2, have you had trouble getting information you trust about the pandemic, COVID-19? And of the 746 respondents, 96% reported having no trouble getting trusted information about the pandemic. Next slide, please. What kind of challenges getting information about the pandemic have you had? When polled for the responses, stating specific issues in the procurement of trusted information related to COVID-19, 96% failed to respond. This is likely due to the negative response submitted for the qualifying question, which preceding this particular survey item, see question 2, amongst the survey pool, the leading response question was, the information is hard to understand. However, only 8 respondents given this answer expressed a challenge that this challenge is only applicable. So it's a slightly 1% of the responding group. So essentially, this question we later learned regarding the challenges didn't get answered to as in-depthly or as specifically as we'd like. So we learned something from this question for future responses. Next slide, please. Did anyone do a good job
Hold
explaining?
on 1 second, sorry. You were already on the next slide. Thank
I'm sorry.
you.
Did anyone do a good job explaining COVID-19 to you? When questioned whether or not anyone did a good job of explaining COVID-19 to participants, over 700 people responded in the affirmative. This represented 95% of the study pool. Slightly over 30 indicated displeasure in the quality or availability of explanations on the COVID-19. Next. Question was, please provide the role of the person who did a good job explaining. And when questioned about the various roles and titles that those providing responses with COVID information, the study voiced that 351 unique responses, and we had those listed, but the majority of those responses included a mixture of family members, doctors, nurses, healthcare providers, and friends. I was not particularly pleased that our team wasn't listed here, but we learned something from this question. Next slide, please. Please mute yourselves. Are you following public health recommendations such as how to protect yourself, which included the common protections of wearing masks, washing hands, social distancing, and getting tested after experiencing symptoms? And 96% reported following the public health recommendations for prevention, and 26 reported not following those based off of the time period we were in. Next slide, please. And we're moving, we are in the second domain. I apologize for mentioning this is detection and prevention. Has it been hard to follow recommendations to protect yourself? And of the participants, 600 reported prevention recommendations as not being hard to follow. And this represented 81% of the respondent pool, with 143 expressing having difficulty following the recommendations to protect themselves. Next slide, please. Do you know why masking and hand washing are needed? And 82% understood why they were needed, and 18% reported not knowing why they were needed at the time of the survey. Next slide, please. Do you know the question? I'm sorry, do you know the symptoms of COVID-19? And they're listed. And 65% at the time reported being familiar with the symptoms, with 35 being unfamiliar with the majority of the symptoms. Next slide, please. Have you been tested? 694% at the time of the survey reported having had been tested, or 93% total. Next slide, please. Have any of your family members, have any of the following happened to your family member because of COVID-19? When the survey various health-related events that may have happened to family members due to the pandemic, we ended up with 46 unique responses, and the majority included a mixture of health-related symptoms, such as hospitalization, quarantine, and getting sick, and passing away. In our questions, I should note that we tried to use as language that we believe that was easily understood. Passing away was used to describe death. Moving into the third domain, the impact of COVID-19 on employment and career. Are you employed? Do you have a job? And assessing the impact of COVID-19 on participants' employment and career opportunities, it was revealed that at the time of this survey was administered, that 80% were unemployed, and that 620 unemployed respondents seemed to loom large over the overall 126 respondents reporting at the time. And I should note that when meeting with the vendor was not aware in detail of the unemployment percentages, and we did discuss this as being alarming, but we did have opportunity to explain that overall employment outcomes are not where we would like things to be. Was your job impacted by the pandemic? When surveyed regarding this, of course, we stated, but amongst the 126 that were employed, 64 of those attested that it had little to no impact on their job. And what we related this to in further discussions unrelated specifically to COVID is that many of the people that we support worked in industries that did not have the benefit of being able to telework at the time. Just an interesting point to note. Next slide, please. Do you attend a day program or any other out-of-home program? 46% reported participating in day program or some out-of-home program, and 56% reported not being involved. And this was people who were involved prior to the pandemic with out-of-home activities. So that wasn't particularly negative outcome for us because at the time, lots of people were not leaving their homes to participate in external activity, and many people that we supported were continually being active. And then the next question follows that: was your day program impacted? In the survey, 42% reported that it did impact their day program, and 51% reported no. And this was again at the time. A large portion of the individuals reported that it had little to no impact due to the fact that individuals who were not in day programs, either working or participating in IDS at the time. Do you use a direct care worker, and that was the term chosen, in the home health aide, personal care aide, or unpaid family caregiver? And 79% of the study participants reported having direct care in their home, and 153 did not use direct care in their home. And this was interesting because we talked about having a way to mitigate people coming into people's homes and you know, lessening the likelihood of exposing the person at that time. Question 17, has the direct care worker assigned to you changed due to COVID-19? And the impetus behind this question was that there was a high turnover rate at the time of the height of the pandemic. So what we had here is that 14% had people who would be coming into their home change due to the pandemic, and 65% had little to no change, and 21 provided no response on this question. And then there were additional responses. Question 18, which I have on the next slide, is: have any of the following happened to you or your co-workers, day program staff, or other direct care workers because of the pandemic? And there were 30 unique responses to this question, and the potential could have been gotten sick, hospitalized. Oh, we do have this, quarantine with symptoms, or quarantine versus exposure, passing away, or others. So we did have 30 unique responses, and we'll attempt to break those down and post those so that you can see more detail of what those were. Question 19, are you able to protect yourself, wear masks, wash hands when working at your day program or receiving supports in your home? And 92% reported being able to participate in methods of prevention in the workplace, at day programs, or at home. And a small percentage reported that they did not and have the ability or have the proper understanding of washing their hands, wearing masks at the time of the survey. Next slide. Oops. Okay. Since the pandemic, COVID-19 outbreak, have you been able to assess your healthcare? And we consider this a very important question because there were concerns. 687 reported being able to obtain their regular health care without any hangups or challenges. Proportionally, this number represented 92% of the entire pool, which we consider favorable. and 59 reported not having access to regular health care, or 8%. And that was concerning. But I think that when we go back and review this, we talked about the fact that telehealth was not as readily available early on. At question 21, has your access to healthcare changed from in the office to visiting? And here we had 362 reported that their healthcare changed from in office to remote, which was about half, but at the time, from my recollection, it wasn't as readily accessible at the time that the survey was done. So at 50%, it would be interesting if we were to ask this question today, whether the numbers, and I'm sure they would be high. Question 22, next slide. Are you experiencing anxiety or depression related to the pandemic or COVID-19? And 8% or 61 individuals reported anxiety and depression related to the public health emergency. And this was a rather positive finding considering. Next slide, please. Are you able to access mental, emotional support and services during the pandemic? The qualifications for question 23 calls 92% to submit no response, leaving the remaining 8% of the study participants, 100% of that pool, because the people who have reported not experiencing, and of that, 75% of those who reported having depression or anxiety did report having access to emotional support needs at the time. Next slide. Since the pandemic COVID-19 outbreak, have you had any trouble picking up medications from the pharmacy? And 97% reported having no issue with receiving their medication from the pharmacies at the time. Next slide, please. Since the pandemic, have you needed medications more often than before? And 709 reported that they did not have any or more an increase in dosage or amounts of medication as a result of the pandemic. Next slide, please. Since the pandemic outbreak, have you had trouble attending activities out of home? And we define activities as bowling, chateau, and these were based on an initial survey of what people actually were doing prior to. So many people were going to activities as bowling, and we were finding that many were attending activities such as going to nightclubs. In assessing the proportion of study participants who had trouble attending activities away from their homes since the pandemic, was revealed that 35% did not report having issues, and 65 reported having no issues. Did report having issues, and then 65 reported having no issues, which was interesting because the actual time frame, some venues and our activities such as bowling and other places were open to some, but it also was interesting that these numbers weren't higher. But I do want us to, at DDS, do an analysis relative to where we were at the time, a more detailed analysis of where we were in terms of the shutdown, to look at this more in detail, this specific question. Has the cancellation of important events, birthdays, parties, picnics, dances been difficult to you? And 619 reported that there were not important events that posed a difficulty for them. So, you know, from my own personal experience, I do know that certain family members and close circles of people were continuing to get together, and we see that that seemingly wasn't a major challenge for people that we support. Question 28. Due to the COVID-19 public health emergency, have you felt isolated from your family and friends? And 25% reported feeling isolated from friends and family, and 75 reported no feelings of isolation, and sort of related to the previous question. And this is the domain on the individual health and the ability to interface externally with family and friends. Question 29, before the pandemic, what type of transportation did you typically use to get around for your work, day program, and treatment? We surveyed the various methods of transportation that respondents typically used to get around prior to the pandemic. Over 81 unique responses were voiced. The most frequently reported methods were ADA, air transportation, public transportation, personal car, ride share, respectively. Next slide, please. How hopeful are you that the pandemic will end soon? And I just want to remind people that these questions were from the period of time that we were actively involved in the pandemic. 701 reported that they were very hopeful that the pandemic would end soon. This number represents 94%. And lastly, I'm going to review the recommendations that I reviewed when we did the initial overview. And when the services needed to be reduced, the vendor recommended that we ensure that there are processes, and that's a typo, to reintroduce services with meaningful timeframes. And when we discussed this with the vendor, this was to ensure that we had proper planning, as opposed to when the lockdowns were lifted, that we had done, and they obviously weren't aware of all of the details of the behind the scenes work that DDS was doing, because we didn't share that with them. And what we recognized is that the people that we supported also didn't know what we were doing behind the scenes to sort of reintroduce services to people we supported. So that was in line with what we would likely expected. And then second, we prepare a booklet or other materials for DDS participants and their caregivers to ensure that there's an understanding of specific instructions, lists of resources, and signs and symptoms. And this was especially interesting to me because I thought that with all of the efforts we made, that this would have been, this wouldn't have been something that would have been reported to our vendor, because we had forms, we did mailers, we had staff calling family members to check up on them, we had interfacing with our health and wellness and service coordination team. But what we learned is at times that you can never do enough during a situation like this. And then in the event of another public health emergency, start the process of conducting a survey earlier in the pandemic to determine the impact of the pandemic at its peak. This survey was conducted in October 2023 through May of 2022 through May of 2023. And so I didn't take offense to this recommendation, because at the time when we reviewed this with our vendor, I really thought more about what our resources as this agency was focused on. And there was a lot that could have been said that wasn't. So we were focused on keeping people safe and alive at that time. A survey wasn't necessarily something that I was thinking about, but maybe, hopefully we'll never have another public health emergency. But if we do, maybe calling people and asking them what their experiences are during the pandemic may be useful. So if there are any questions, recommendations, or suggestions, and lastly, the project manager on this, Angelica Ross, her contact information is here. If there are questions later on that come up, and she reports directly to me, and she'll report any questions or suggestions that you have. And we'll review those, take them to part. But if there are questions now, we have a few minutes. I'll attempt to, and this will be uploaded once I correct the two typos.
So as we wait to see if there are any questions for Winslow regarding the COVID study, I was reminded that I failed to mention at the beginning of our meeting in announcements that October is just around the corner. And as people may recall, legislation, or we had we didn't require legislation. We had an enhancement to our budget starting at the beginning of fiscal year 24, which is October 1st, which will allow us, say finally, to increase personal needs allowance for people who are receiving SSI and SSDI. So that currently those people are receiving $100 of their check. The rest is going to support to provide a portion of the cost of their residential supports. But starting October 1, that will be $150. That will be in effect for the next 15 months. And then in January 1, 2025, and going forward, we will adjust it each year to keep it in line with whatever the cost of living increase is that's provided by Social Security. This is like a technical matter. When it was added to the budget this year, and I'll be saying this again a few times between now and our budget hearing next spring, it was added as one time only. And at the time we said, clearly, no one thinks this is going to be one time only, but this will be one thing that we will see again, that we'll have to make sure that we're advocating is in our permanent DDS budget. So it will be starting October 1 and is in our budget for the full year of FY24, but you will see reference to it when we go to our FY25 budget hearing. Everyone recognized that it is something that you don't give for 1 year and take away. It's just something we need to make sure that we put in the continuing budget going forward. There were sort of budgeting reasons, and the fact that they have to do 4 years out, and there were a lot of technical reasons for why that was done. We need to make sure that it is in our continuing budget so that we don't have to ask for it each year. But so that people know, starting October 1, we have checked with OCFO just to confirm that everything is in place. The amounts that go to people of their check will increase by $50. Are there any other comments or questions that people have? Okay, well, thank you very much to all of our presenters today. Our partners from DC Health, as well as Ms. Menkiaj and Winslow. And the COLA will start in fiscal year 25. So there won't be a COLA 3 months out, there will be a COLA 15 months out. There was a question, I'm sorry. There's a question in the chat saying I missed whether the COLA is going to happen. The COLA happens, there is a COLA every January for Social Security. The increase in the personal needs allowance will be aligned with the COLA starting in fiscal year 25, but it will increase then January 1, 2025. Okay, well, if there are no other questions, have a great weekend, everyone. Enjoy this last sunny day before a rainy weekend coming up. There's also on Sunday, in recognition of Hispanic Heritage Month, an event. In the district. Um. So, sorry, I don't have that information to share, but watch your emails. I know that the Mayor's Office of Latino Affairs has been sending out notices about their event. Actually, it is on Sunday morning. Sunday the 24th. Fiesta DC, and it will be occurring downtown. I'm trying to look quickly online. I'm sorry, maybe I should have brought up, but anyway, if people Google Fiesta DC or look at the Mayor's Office of Latino Affairs, there will be an event downtown Sunday, starting at 11 a.m. Have a great weekend, everyone, and we will, thank you very much. There's a link in the chat to fiestadc.org where you can find information about the event on Sunday. So there's actually events all weekend, but I know there's something the mayor will be in attendance that Sunday morning. So have a great weekend and enjoy the rest of your day. Bye now.